Welcome to our YouTube channel Nursing PRNCFET. Subscribe our channel and click on bell icon for more updates. Our today's topic is most important questions. All questions are asked in previous staff nurse exams. Question 1. A patient with heart failure, which is the accurate indicator of such patient's health status? A. Weight of the patient. B. Urine-specific gravity. C. Vital signs. D. Intake and output. Correct answer is A. Weight. Question 2. Which type of data does auscultation provide? A. Subjective. B. Objective. C. Secondary source. D. Medical data. Correct answer is B. Objective data. Question 3. Which of the following is reason for intradermal injection to be used for testing allergic reactions? A. It diffuses rapidly. B. It diffuses slowly. C. Less painful. D. Easy to administer. Correct answer is B. It diffuses slowly. Question 4. Which route of drug administration provide a rapid response in a patient? A. Oral. B. Sublingual. C. Intramuscular. D. Subcutaneous. Correct answer is B. Sublingual. Question 5. In which type of sleep most vivid dreams occurs? A. Non-hibernation sleep. B. Rapid eye movement sleep. C. Hibernation sleep. D. Non-rapid eye movement sleep. Correct answer is B. Rapid eye movement sleep. Question 6. The purpose of deep palpation is to assess A. Skin turgor. B. Temperature. C. Organs. D. Hydration. Correct answer is C. Organs. Question 7. Achilles fracture refers to the fracture of A. Radius. B. Ulna. C. Humerus. D. Olecranon. Correct answer is A. Radius. Question 8. Surgical repair of hernia is A. Herniorrhapy. B. Fistulectomy. C. Herniectomy. D. Laparoscopy. Correct answer is A. Herniorrhapy. Question 9. Vertigo is due to problem in A. Middle ear. B. Tympanic membrane. C. Inner ear. D. External ear. Correct answer is C. Inner ear. Question 10. A score of 3 in Glasgow Coma scale indicates A. Lethargy. B. Deep coma. C. Fully responsive. D. Moody. Correct answer is B. Deep coma. Question 11. A nurse is caring for a patient subjected to total laryngectomy should plan for A. Oral feeds. B. Supine position. C. Alternative communication method. D. Keeping tracheostomy cuff fully inflated. Correct answer is C. Alternative communication method. Question 12. The most common adverse effect of chemotherapeutic drugs is A. Nausea and vomiting. B. Constipation. C. Diarrhea. D. Painful mouth sores. Correct answer is A. Nausea and vomiting. Question 13. Barrel chest is seen in A. Kyphoscoliosis, B. Rickets, C. Pneumonia, D. Emphysema. Correct answer is D. Emphysema. Question 14. K-bind is given to patients with A. Hyperkalemia, B. Hypokalemia, C. Hyponatremia, D. Hyponatremia. Correct answer is A. Hyperkalemia. Question 15. Which risk factor for diabetes mellitus is non-modifiable? A. Poor control of BSL, B. Obesity, C. Physical inactive, D. Age. Correct answer is D. Age. Question 16. Color blindness is due to the problem with A. Cones, B. Rods, C. Aqueous humor, D. Lens. Correct answer is A. Cones. Question 17. Waiter's tip position is seen in A. Bell's palsy, B. Facial palsy, C. Erb's palsy, D. DDH. Correct answer is C. Erb's palsy. Question 18. Census are done at A. 2 years, B. 5 years, C. 10 years, D. 12 years. Correct answer is C. 10 years. Question 19. All of following are to negative health indicator except A. IMR, B. Death rate, C. Life expectancy, D. Perinatal mortality rate. Correct answer is C. Life expectancy. Question 20. Which for the following listed drugs is a proton pump inhibitor? A. Pantoprazole, B. Ranitidine, C. Famotidine, D. Amikacin. Correct answer is A. Pantoprazole. Question 21. The type of seizure which involves both sides of brain is called A. Generalized seizure, B. Partial seizure, C. Primary seizure, D. Secondary seizure. Correct answer is A. Generalized seizure. Question 22. Hepatitis C is most commonly transmitted through A. Infected blood, B. Breast milk, C. Sexual contact, D. Kissing. Correct answer is A. Infected blood.